Neurolutions has been at this for a long time, and all credit to the company for fighting for this technology for over a decade. And that's resulted in pent-up demand almost. How does somebody who has been looking for something like this get it today?
It's really interesting when you think about the psychology of stroke survivorship, that for people, when they have their stroke, where you see them most acutely is where they need the most care, right? They've not yet come into a stability in their life and figured out what life post-stroke is going to look like for them. We estimate about 3.3 million people in the United States with an upper extremity disability post-stroke. And once they learn about the opportunity to restore lost function, amusingly enough, it's not skepticism that is the first reaction, it's action is their first reaction is, I want one, tell me about it later. And so for us, getting the message out there about the product's availability, getting it to the appropriate patient population and providing them the excellent support that we can with your partnership is how we can assure that those that get it get the outcomes that they want.
This is not a disengaged community. They are so willing to fight for their ability to live their lives, live their best lives every day. I think that places such an important obligation on the companies that are serving them to not take advantage of that willingness to try, to not rush into things. And so to have a technology like IpsiHand that's so grounded in great science, that has done the clinical studies and continues to do clinical studies, and has gone through that appropriate consideration with the FDA is really important. And then to pair that, I think, with clinicians who have this deep expertise in stroke. I think one of the things I'm hearing is these patients have to go find somebody to prescribe the device. There are gatekeepers for appropriate reasons, but how many primary care doctors are fully conversant in post-stroke rehab and recovery for chronic conditions, not to mention brain-computer interfaces? So yeah. I'm just delighted that the clinicians at Kandu Medical Services can provide that independent assessment and help patients navigate that path to start the rehab, because they're all so anxious. Let's start this recovery as soon as possible.
We've both learned a tremendous amount about the journeys of these individuals, about the parts of their journey that are smooth and the parts of their journey which are turbulent, uncertain, and with mediocre or very little support that can enhance their patient journey, right? I think that very often when people see a stroke survivor with a disabled arm, they intuitively say, your arm is disabled, because that's what I can see. Mm-hmm. And they forget that the injury did not occur in the arm, it occurred in the brain. Right. And what we've done historically is that we've taken stroke survivors and we've sort of sliced up all the subordinate disabilities or the impairments and managed them all independently. I think that one of the most beautiful things that Kandu is doing is it's taking a holistic view on patient health and for the care of these stroke survivors and treating them as an individual, and not just saying we're going to take care of one aspect of your health. It's no, we want you to have a great life.
One of the things I'm most excited about is that nobody is just their upper extremity disability.
No.
Right? There is a whole person there living their life. So not only are they defined just by that upper extremity disability, they also have a whole constellation of other things. When we look at stroke, they might be managing fatigue, language deficits, attention deficits, visual impairments. And IpsiHand is not just an opportunity to restore function that has been impaired for many of these people for years. You're serving clients who've gone 3, 5, 7 years without being able to use that arm, but then to re-engage in the whole person. Mm-hmm. And look at how can these clinicians with this expertise in stroke recovery help you not just recover your arm use and use that arm in day-to-day life as you get your function back, but let's explore all of the things that you've been struggling with. And I feel really strongly Kandu is bringing services to stroke survivors that haven't existed, that people have needed for a long time. And while we are right now focused on finding people as they're discharging from hospital, helping them with that early recovery during that time of trauma, I know there are 8 million people in the United States who already had that stroke and never got the services and probably still need that support.
It's so important to have the tool, but it's also fundamentally essential to have the clinical staff behind the tool doing remote patient and remote therapy monitoring to make sure that the person who's using it is using it right. At the end of the day, the product is a tool. And it takes the hand of an excellent clinician with domain knowledge to know when that tool is best applied. And it takes an excellent support organization to know how to best administer it, modulate it, use it, coach, condition. And so it's the combination of the technology and the people that assures the best clinical outcomes. And through our partnership, that's how I believe that we can deliver the best clinical outcomes to this patient population.
Yeah, I'm really excited. I think we've been talking now for probably 6 years about how these things come together.
Both companies are on an upward trajectory that is simultaneously aligned, and they're both hitting their stride at the exact same time.
It's so exciting.
Yeah, it's so exciting that they're in sync, and we have a tremendous amount of opportunities that we can pursue together. We think about chronic, you think about acute, and together we can cover the bases.